You've seen the mushroom serums and the stress reducing skincare claims, but do adaptogens really do anything for your skin? I'm Dr. Alice Mina. Welcome to my channel, The Skin Real, where I help real people break down the difference between hype and helpful for their skin health. On this week's episode, I am taking a deep dive into adaptogens, and I'm doing this with my friend and colleague, Dr. Jacqueline Watchmaker. She is a board certified, fellowship trained dermatologist practicing in Arizona, and she has actually been on the forefront of some of the clinical trials surrounding adaptogens in skincare. So, who better to help break down science versus hype? Now, the word adaptogen, it has been everywhere recently, from smoothies, supplements, wine. But what does this really mean, and how does this really help our skin? Adaptogens have actually been around forever. It's almost like medicine coming back full circle, which is what people really want nowadays. They don't want what seems like very sterilized, medicinalized skin health and whole body health, right? Like we want to feel like we are doing things that are natural for our bodies, that are more in alignment with nature. And I totally get it. But here's the thing, you don't want to be spending a lot of money on snake oil and hype. You want to make sure if you're doing these things that they actually really work because they can be a little bit pricey. So, in this week's episode, I am breaking down what adaptogens are, what the science says about their effects on the skin, and which ones are worth your time and money, and how to use them smartly, not just because an influencer told you to. Let's get into it. Dr. Watchmaker, thank you so much for being here. I'm thrilled to have you back on the podcast. You were one of my earlier guests, talked all about lasers. And now I'm really excited to talk about adaptogens because this is something that I'm hearing a lot about. And I have to be honest, I don't know a lot about them.
Yeah, it's an exciting topic. And what's interesting is adaptogens have been around in medicine forever, since ancient times, native medicine, Ayurvedic medicine. But just in the past, I think like 5-ish years, have they really gained traction and attention, especially more in the skincare space. They've also been around in the wellness space for longer than the skincare space, but I'm excited that they're gaining popularity in our field. And adaptogens basically are plant extracts. They're derived from plants, and they basically are any plant extract that helps the body respond to stress. And stress can be a lot of different things, as all of us know. It can be, environmental stress like UV light and pollution. It can be actual, physical stress like burnout or recovering from a workout or sleep deprivation. And this broad class of plant adaptogens basically just help our body return kind of to its normal state of balance and help the body kind of bounce back. And it helps the body with like resiliency. And you can ingest oral adaptogens, like a lot of people know about ashwagandha. But again, I know what we're going to be talking about more today is the topical use of adaptogens in skincare.
I'm glad you brought that up because that was going to be my first question. Like, what are adaptogens? I think I first, I kind of heard the word and then I was going to a wellness event and they had adaptogenic wines and food and products. And I was like, oh my gosh, like, it sounded really cool, but I had to be honest, I didn't really know what it was. And yeah, I think skincare, it's only very recently that I've started hearing about adaptogens in skincare, which I think is really cool. It's almost like we're of coming full circle, right? With skin health and medicine. We're kind of going back to our roots, right? With medicine and healing. And I think that's a lot of people want that. They feel like medicine's become pretty sterile, pretty pharmacological interest and desire to bring things to a more holistic, natural approach.
I totally agree. And something I love about adaptogens, especially some of them, is it kind of blends like, natural holistic medicine, but there are some great studies and they've been around for a long time. So it's not just voodoo. There actually are some great studies showing their benefits. So I think it's like the perfect blend. And I think you're exactly right. It's kind of what a lot of people are looking for now.
Absolutely. So tell me more about adaptogens in skincare and in topical formulations. Like, are these commercially available? Because until your talk, I didn't actually even know we had some.
Yeah, they are commercially available. things like Panax ginseng and hops extract, some people classify like turmeric even as kind of an adaptogen. They have been in a lot of our skincare products, but one product in particular really kind of had adaptogens be kind of the hero concept of the entire product. And I think that's where it started to gain some traction. So they have been kind of added as supportive ingredients, but now they're kind of becoming the forefront kind of hero product. And I use adaptogen, products with adaptogens in it every day. I actually brought my, one of them, Maestro Active Balance Serum is one of my favorite ones, and I use it every day. There's a ton of great data on it. And then actually, it's a little pricey, but I do love it. This product from La Mer also has Microcystis peripheral ferment, which classically isn't 100% always classified as an adaptogen, but more studies have been emerging, and it's now kind of thought of as this emerging adaptogen that can really help impact the stress pathways in the skin. There are other products as well. I know there's this one Origin product that contains like some mushroom extract and then lots of others as well.
Yeah, that's great. I mean, we can say brand names and trade names on here. I'm not affiliated with any of these products, but I think people are craving that too. It's like, okay, we talk about all these products, like just tell me where I can find them, right? And where I can actually get them. So I do think that's helpful. I'd love to know, how do you incorporate it into your skincare routine? Because I know as dermatologists, right, like we usually like to keep our skincare effective but pretty simplistic. So where does it fall into your routine?
Yeah, so adaptogenic products, especially if that's kind of the, primary component of them, they're actually great for everyone, which makes them a little tricky because it's like, where does it actually fit? Who is it actually best for? But they are, categorically great for sensitive skin. They're not abrasive. They don't really exfoliate. They don't irritate. A lot of the studies have actually been done in like post-procedure studies, so they're safe usually in the post-procedure period. I personally like to incorporate them usually either morning or night. And like you said, I like to keep things simple. I kind of like 3 steps in the morning, 3 steps at night. So usually I'll give an adaptogen cream to someone who has like stressed skin. So someone with like rosacea, background chronic redness, someone who's still struggling with a little bit of, breakouts, someone whose skin looks kind of under duress or under stress. And I'll either incorporate it kind of around the same step as your antioxidant, or sometimes I will, because there are some antioxidant properties with adaptogens. Sometimes I'll even swap out like a vitamin C antioxidant cream and instead give them an adaptogenic cream. So I personally use like Maestro Active Balance Serum usually in the morning. Usually I'll just like wash my face. I'll put on Maestro and then usually just moisturizer and sunscreen. And then at nighttime, I'll wash my face. You could use it again. I do find some of these products, because again, they help the skin balance stress. Sometimes when people are first starting like a retinoid or a vitamin A cream or products with more kind of slightly harsher active ingredients, they can get irritated and red. And I actually find sometimes my patients, if they incorporate this, can use their active ingredients kind of more consistently and, quicker, without having that irritation. So that's another place that I use them.
That's amazing. Yeah. So it's not necessarily like replacing, but you actually can tweak it a little bit. And I find a lot of people, first of all, it's so overwhelming to know what to use, right? And they think, well, my best friend's using this, the celebrity's using this, I need to use all these things. But you actually can kind of play around with it and yeah, maybe use a adaptogen instead of a vitamin C serum that everyone else is using, because maybe that's really not what your skin needs right now. It needs a little more nourishment, a little more healing versus, some acids that could be a little more irritating or abrasive.
Exactly. And I know like K-beauty and, Asian skincare is big right now. And they're all, the concept behind some of that skincare is more supporting skin barrier, increasing hydration, less true active ingredients or like harsh active ingredients. And I do think adaptogens fit well with that.
Right, exactly. Instead of always trying to like combat something, fight something, right? It's more like supportive care, if you will.
I also personally do a lot of procedures like lasers, and I do love these products because sometimes it can be confusing, like how to prepare your skin for a procedure and then what to use after the procedure and when can you go back to your normal skincare routine, like how long after the procedure. And for many of the procedures that I do, these adaptogenic products can be used before to kind of help prepare the skin, immediately after, and then they're also just great to continue to incorporate in your daily use.
Yeah, I do a lot of procedures too beyond just surgery and lasers and all that, and it's truly amazing how using the right ingredients before and after can improve the healing of the skin. I mean, it's just amazing. That's a great advice there. What about you had mentioned earlier, like that there actually is some data behind this? Because I think in medicine, sometimes we're a little slow to adapt to things or iterate and bring new things on because we want data. We want the actual evidence to support it. And, is there evidence to support using adaptogens?
There is, and I know, like, orally ingested adaptogens like ashwagandha, again, it's been around forever. There is some great data showing that it actually does help reduce the body's stress, specifically with topical adaptogens. There have been both in vitro and, more clinical studies showing their effectiveness. They've looked at biomarkers, they've used epidermal skin models. So there is some, good, robust data, and I think more continues to come out.
That's great to know. So if someone's thinking, I do want to try some adaptogens, where do they begin, right? Because it's like, where do you even start to investigate or find good companies or products?
Yeah, I think it's hard because, again, it is kind of a newer category, and I think because it is trendy, a lot of companies are kind of just, like, jumping on and saying, like, "Oh, we have adaptogens." I think similar to kind of the whole exosome thing, they're like, "Oh, we have exosomes, actually." I mean, the 2 companies that I know that have done the most data and have kind of looked into it for years now would be Skin Better Science and, like, their Maestro product. Maestro Active Balance Serum was their original product, and then they just launched Maestro Revive, which is kind of the 2.0. They're marketing it more for kind of hormonally imbalanced or menopausal skin. And then La Mer has done some great studies as well. Again, both in vitro and in vivo studies. So I would kind of start with those 2 companies and go from there. Origins, I know, is slightly less expensive and also has some great adaptogenic products as well.
Yeah, I'm glad you brought up how you do have to be careful, right? Because I do feel like the word adaptogen, it's a buzzword, just like exosomes. And people ask me, like, do you believe in exosomes? Do you like them? I'm like, well, I do, but you have to be careful because some people are just slapping the name on things. They don't really know what it means. They don't really contain what they say they do. So, yeah, I think sticking with companies that have done the research, done the science, and a lot of times, at least right now, they're not, your $10 skincare products, right? Like, they're a little pricier, but I do think if you're gonna start with a product like this, go with the companies that are actually doing research and, invested in the research and development of their products, I think is important.
100%. Yeah. And just personally, like, I've had, patients on some of these products for a while. I did do some of the clinical trials as well, and patients, like, love their skin. And, sometimes when you do clinical trials, patients will, like, use something for the trial and then, go back to their original regimen, and I can't tell you how many patients from the trial continuously come in to get the product because they see the changes in their skin. And a lot of my, patients who even weren't in the trial, they're like, they know it's expensive, but they love the results and they do make the investment to keep using the product because they see the changes.
Yeah, and I always, not all my skincare is super budget. I mean, nowhere to splurge, nowhere to save, right? Things like adaptogens, exosomes, antioxidants. I would say those are the products that you do want to invest a little bit more in versus your cleanser or maybe a very simple moisturizer, right?
I totally agree.
Yeah, knowing where to invest and where you can kinda save, I do think is an important distinction, and again, like, just not using a lot. If you're only using one product that's a little bit pricier, at least the girl math to me makes sense, like, "Okay, I can justify that."
I totally agree.
What about adaptogens in more supplement form or dietary? Do you ever make recommendations? Let's start with supplements. Any adaptogen supplements that you recommend for skin health?
Honestly, usually I'm recommending topical adaptogens. I think, let's use a product that goes right to the source that we're trying to improve. Personally, I'm not, the biggest supplement taker myself. There are some other great supplements for skin health, and if a patient, wants to take a oral adaptogen supplement, I definitely won't tell them not to. There have been some studies showing some oral adaptogens do help with skin health and quality, but I think those studies are a little bit not as robust as some of the topical studies. So I typically try and, you know, shift them towards topical adaptogens if like skin improvement is what they're actually looking for.
Yeah, I think too, that's one of the great things about being a dermatologist and taking care of skin. It's so easily accessible, right? It's not like your heart where we can't reach it. So yeah, if you've got skin concerns, I really love to address it topically with products. Of course, with like whole body health and things like that. But I do find like if your skin's your concern, then there are some really amazing topicals that can go right to the source.
I agree. And sometimes, I know there's great supplements out there and great companies that make supplements, but I do think there is more variability in what is actually in the supplements. They're slightly less regulated, than medications that you orally ingest. So, yeah, I'm all for the topical.
Yeah, people are gonna metabolize them differently. Is it really getting to the skin, right? Certainly, they could probably help with, like, whole body health and stress and things like that, which could be, of course, a benefit as well. What about safety, right? Are there any safety concerns we should be aware of with adaptogens?
Honestly, from what I personally have seen and from the studies I have seen, not really. And that is a great thing about this category of products. They're great and actually kind of geared towards patients with sensitive skin. I haven't had one patient tell me that they can't tolerate, an adaptogenic cream that I have given them. And again, I do routinely use them in the post procedure period with zero issues. So, honestly, if a patient comes with sensitive skin, this is a category of product that I'm going to, recommend even more so than others.
Yeah. And what about pregnancy, right? Because I know there's so many things we tell pregnant women to avoid and not use. Any data on this?
No data, of course, no, companies are going to do studies on this. However, personally, I am going to continue using my creams during pregnancy. I don't see of any reason why they couldn't be used during pregnancy. I do think we, even in dermatology, restrict what women can use so much, and it can be really frustrating. And of course, you want to always err on the side of caution, but I do think, speaking from zero data, but I do think that this would be a category of products that overall would be on the safer side to use during pregnancy.
Oh yeah, I'm totally with you. I feel like we put women, we force them to spend 10 months, right? 40 weeks not doing, getting to take care of themselves or their skin at all. So, yeah, I feel very comfortable recommending this to my patients and especially if they are during that first trimester having those skin flares. I think it can be very soothing for the skin. So, yeah, I think it's great.
I agree.
Amazing. Well, this has been a ton of fun. I love learning about this. I didn't know about Maestro, but I definitely a fan of Skin Better and love the work that they're doing. And thank you so much for coming on and like shedding some light into this area because I think we're going to be hearing a ton more about topical adaptogens.
I agree. Thank you so much for having me.
I know people are going to want to find you and follow you. You do amazing work in Arizona. Where's the best place for people to connect with you?
Yeah, well, I'm cosmetic medical dermatologist in Scottsdale, Arizona. I work at the Center for Aesthetic and Laser Medicine, and my Instagram is Dr. Jacqueline Watchmaker, so they can find me there.
Amazing. I will include all that in the show notes, and thank you so much for being here.
Thank you for having me.
Bye.